Hi, my name's Semi Kadak from Body and Birth Physio, and today I just want to give you a couple of quick pointers on how to stand well while you're pregnant. So the key points that we're going to go over are where we want your pelvis and your rib cage to be, because they have such a big influence on what can happen with your pelvic floor function, so maintaining that good pelvic floor strength and also contributing or not to good function of your core abdominal muscles and preventing unnecessary strain on the connective tissue of your linea alba, and that's where we would experience abdominal separation or diastasis recti. So easiest is to see from the side. As your belly grows, your weight, your center of gravity changes as that weight increases. And the tendency, especially when you're exhausted and tired, is to kind of let the hips and the tummy go out in front. Unfortunately, this does create a little bit more stretch on your belly because everything's pushing forward. We're getting a bit more lengthening this way. So if we're able to keep your pelvis kind of stacked over your ankles, you're going to allow for better function of these abdominal core muscles and less stretch on those tissues. The other reason that we want your pelvis to be over your heels is because your pelvic floor can function best when your bum muscles, so your glutes, are able to participate in how you're standing. So when you're stacked and everything's just on top of each other, as opposed to when you're hanging out, pelvis in front, pelvic floor gets to switch off, glutes gets to switch off, and there's not a whole lot of activity happening there. So trying to get hips stacked over heels. The other thing that I commonly see for mamas is the rib cage tends to flare a little bit. And this is a habit not just during pregnancy, but for most people, I'll see it on a lot of people. The rib cage, because we've always been taught chest out, shoulders back is good posture, the ribs do tend to lift a little bit and we end up either here or here. But this lifting posture will tend to create a lot of tension or tightness through these muscles in your mid-back, a bit more loading or pressure in your lower back, and again creates a little bit more stretch in the front of your tummy here. So once we've got the pelvis stacked over the ankles, we can almost just relax the rib cage so that it is now stacked directly over the hips and the ankles as well. Doesn't have to be perfect all of the time. These are more just little things that you can check in with and notice. Are you creating any pressures or tensions within your body that your tissues are going to then adapt to? So key points: pelvis over your ankles, rib cage relaxed, just when you get a chance to think about it, not 100% of the time necessary. So I hope you find that helpful. For a lot of women, it does take a lot of the strain from their lower back, and again, just allows good function of your tummy muscles and for your pelvic floor throughout your pregnancy.